what's your experience been like delivering mental health care over video?
Yeah, it's been interesting. So I started doing mental health care with video about 5 years ago. My practice specializes in people with type 1 diabetes. And so I only see people with type 1 diabetes for diabetes specific mental health concerns. And so since there aren't very many providers, I get lots of requests from around the country for services. And I realized that I had the ability to provide services to people who didn't live in San Diego. And so about 5 years ago, I started doing tele-mental health, and it's been a really interesting experience. It's been great from my perspective. When I first started, I was a little bit nervous. It's a little bit nerve-wracking to think, how do I move from this model that I was trained in, sitting in a room with somebody and working with them, to working with somebody over video. But what I realized is really quickly that it actually, while it's weird for about 2 minutes at the very beginning of treating with the person, it gets very comfortable very fast. And that's been my experience. And that's also been the experience of the people that I worked with, that I've been working with. I've had patients that I've worked with over video who I've never met before. I've worked with them for a long time and I've actually never met them. I have patients who I've worked with for a long time over video and then met them, which is a little bit of a strange experience. And then I have people who I've seen in person and then for whatever reason, they either moved away or they have had transportation issues, or now with COVID, we're doing all telemental health. So people who have transitioned from in-person treatment to telemental health treatment. And for the most part, it's been a really great experience. I'm very lucky that with the whole stay-at-home order, my infrastructure was already set up to provide this type of treatment. And it's, I think that people are really finding it to be really valuable, and just as valuable as it would be coming to my office for the most part.
And one question that I imagine some people don't know the answer to is, you are licensed in California, right? You're a
Mm-hmm.
psychologist, which means
Yes.
how does that work? Like, you can only see people in California, is that right?
For the most part, yes. Yeah, so since I'm licensed in California, I can only see people who are physically located in California. There are a couple of exceptions. There are a couple of states that offer something called guest licensure, which means that as a licensed psychologist in California, I can see somebody in that state for a certain number of days a year. So for example, I have a patient who's in Colorado. And Colorado allows for 20 days of guest licensure from an out-of-state psychologist per year. So basically that person is the only person that who I can see, because I can only use 20 days a year. And so if I had more than one patient in Colorado, I'd have to kind of have some creative scheduling to make sure they fall on the same days. But the general rule, and that doesn't apply to all states. Only certain states allow this type of licensure or guest licensure. So the general rule is, yes, I'm only able to see people who live in or not who live, but who are physically located in California at the time that I'm seeing them for treatment.
Got it. And then I imagine another thing people are thinking is, what is it actually like to be in a therapy session? Like, how do you log on? And is it like this Zoom webinar? Is it totally different?
Yeah, it's almost exactly like this. So in my practice, I use a system called DoxyMe. It's DOXY.me, which is a HIPAA compliant telehealth system. So people log into a website, and I have a personal website. They come when they go to that website, they get to my waiting room. They put in their name, and it shows up on my screen as this person's waiting. And then I start the call with them, and it shows up just like Zoom. Zoom is also an option for people who want to do telemental health. Zoom is HIPAA compliant, and so you can use whatever system you want. But people who are doing telemental health want to make sure that what they are using is a HIPAA compliant system, just to make sure that the patient's privacy is protected. For example, FaceTime, last time I checked, is not a HIPAA compliant system. And so while the president did allow for, he did, over the situation with COVID, the president actually waived a lot of the HIPAA requirements. And so right now people can do therapy over FaceTime. However, it's not something that I would recommend. I recommend that people use a secure system, just to make sure that the therapeutic relationship is kept as private and as secure as possible.
And Mark, you use acceptance and commitment therapy a little bit or a lot? I can't remember.
Yeah,
Um,
I use acceptance commitment therapy, otherwise known as ACT, a lot. And ACT is a mindfulness based therapy where, and for those of you who don't know, ACT is a therapeutic model, kind of in the same realm as cognitive behavioral therapy, where the goal is not to make the symptoms go away. Not so, for example, with diabetes, distress or diabetes burnout, the goal of treatment is not to get someone not to be burnt out anymore. Although that's oftentimes an outcome, the goal is to help somebody to accept the fact that they're burnt out and to live the life they want to live, even though they may feel something they don't like feeling. What we find is that by doing that, oftentimes people actually feel less burnt out, but that's not the explicit goal. The explicit goal is for people to be able to have that outcome that I asked about before. What do you want to get out of therapy, and what do you want to be? How do you want things to be different, even if the symptoms don't go away? Because we can't always make symptoms go away, and we certainly can't make them go away at the snap of a finger. But what we can do is teach people skills to allow them to live a full life that's in line with their values, even if they're experiencing symptoms that are not pleasant or comfortable.
I love that. There's a related modality that Mark knows well called DBT, and there's this video that we'll link to when we publish this, but they talk about this balance between acceptance, like I'm doing the best I can, and I have this thing, and change, and like that dialectic of acceptance and change. I think we see all the time as people with diabetes, like uh, I'm accepting that this is hard, but also like I need to do something different. And it can be really tricky to like balance both of those things. But I think mindfulness is also a core component of DBT, and like can be such a good
Mhm.
tool, for doing that.